Hello and welcome. Today we're diving deep into a serious and potentially life-threatening condition, meningitis. We'll explore what it is, how it develops, its symptoms, and most importantly, how it's diagnosed, treated, and prevented. Meningitis at its core is an inflammation of the meninges. These are the protective membranes covering the brain and spinal cord. The most common culprit behind this inflammation is infection, primarily caused by bacteria or viruses. However, in rarer cases, meningitis can also arise from fungal infections, parasitic infestations, or even non-infectious causes like certain medications, cancers, or autoimmune diseases. Identifying the specific cause is critical for effective treatment. Now, let's delve into the pathophysiology. When an infectious agent invades the body, it can reach the meninges through the bloodstream, or by direct spread from nearby infections like sinusitis or ear infections. Once there, the pathogen triggers an inflammatory response. This leads to swelling and increased pressure within the skull, compressing the brain and disrupting normal brain function. The inflammation also affects the cerebrospinal fluid, the fluid surrounding the brain and spinal cord, potentially hindering its normal flow and causing further damage. Meningitis can affect people of all ages, but some groups are at higher risk. Infants and young children are particularly vulnerable because their immune systems are still developing. Adolescents and young adults living in close quarters, such as college students, also have an increased risk of bacterial meningitis. Elderly individuals and those with weakened immune systems, due to conditions like HIV/AIDS or certain medications, are also more susceptible. Understanding these risk factors helps in targeted prevention efforts. The symptoms of meningitis can vary depending on the cause and the individual affected. However, some common red flags to watch out for include a severe headache, a stiff neck making it difficult to touch your chin to your chest, a high fever, nausea and vomiting, sensitivity to light, photophobia, and confusion or altered mental status. In infants, symptoms might be more subtle, such as irritability, poor feeding, lethargy, or a bulging fontanelle at the soft spot on the baby's head. If you or someone you know experiences these symptoms, seek immediate medical attention. Diagnosing meningitis requires prompt action. Doctors typically begin with a physical examination and a review of the patient's medical history. However, the definitive diagnosis usually involves a lumbar puncture, also known as a spinal tap. This procedure involves extracting a sample of cerebrospinal fluid from the lower back. The fluid is then analyzed to identify the presence of infection, determine the specific causative agent, and assess the severity of the inflammation. Blood cultures and imaging studies, such as CT scans or MRIs, may also be performed to provide further information. Meningitis can be broadly classified based on the causative agent. Bacterial meningitis is the most serious form and requires immediate antibiotic treatment to prevent severe complications. Viral meningitis is generally less severe and often resolves on its own, although supportive care is still important. Fungal meningitis is less common and typically affects individuals with weakened immune systems. Specific treatments target the particular fungus involved. Finally, non-infectious meningitis is treated by addressing the underlying cause, such as discontinuing an offending medication or treating the underlying autoimmune disease. Treatment for meningitis depends on the underlying cause. Bacterial meningitis requires prompt intravenous antibiotics to eradicate the infection. Corticosteroids may also be administered to reduce inflammation and prevent complications. Viral meningitis typically involves supportive care, such as rest, fluids, and pain relievers. Antiviral medications may be used in certain cases, such as herpes simplex virus meningitis. Fungal meningitis requires antifungal medications, often administered intravenously over a prolonged period. Supportive care, including managing complications such as seizures or increased intracranial pressure, is also crucial. Prevention is key to reducing the incidence of meningitis. Vaccines are available to protect against several types of bacterial meningitis, including those caused by Neisseria meningitidis, Streptococcus pneumonia, and Haemophilus influenzae type BSHB. These vaccines are recommended for infants, children, adolescents, and adults at increased risk. Maintaining good hygiene practices, such as frequent hand washing, avoiding close contact with sick individuals, and covering your mouth and nose when coughing or sneezing, can also help prevent the spread of respiratory infections that can lead to meningitis. The prognosis for meningitis varies depending on several factors, including the cause, the individual's age and overall health, and the promptness of treatment. Bacterial meningitis can be fatal if left untreated, and even with treatment, it can lead to long-term complications such as hearing loss, brain damage, learning disabilities, and seizures. Viral meningitis generally has a better prognosis, with most individuals making a full recovery. Recent research is focused on developing new and improved vaccines as well as exploring novel therapies to reduce inflammation and protect the brain from damage. Scientists are also working to improve diagnostic techniques for faster and more accurate identification of the causative agent, leading to more targeted and effective treatments. This continues to improve outcomes for patients affected by this potentially devastating illness.